Thank you, Mr. Speaker. It's a pleasure to be joining the debate, the motion for the budget, our budget this year of 2018-19. To start off with, we'll join some of the other members that have mentioned again. I did do some condolence motions this week, of course, for the town of Humboldt, the Broncos, and all those affected by the terrible tragedy this week. But again, I just want to reiterate that Humboldt and everybody affected by that tragic accident is in our thoughts and prayers, and will continue to be for some time. Mr. Speaker, this budget is going to be interesting to talk to. I'm going to touch on some of the areas at fairly high level. I'll dive deeper maybe into some of the health portions of the budget. But first off, I do want to specifically thank a lot of different people, and I know we do customarily do that. But this past year has been a bit of a different experience for me, and there's a lot of people that I really do need to thank. First and foremost, my family. We have some new members coming into the family. We actually have our eldest daughter is engaged. She's going to be married this June 30th. And Mark Cuthill, her fiancé, is going to be joining our family officially, although he's been a member of our family for some time already, as well as his two daughters, our granddaughters, soon-to-be granddaughters officially. Rhea and Malaya are just a great addition to our family as well. I've talked about my granddaughter Winslet quite a bit, and she's become a bit of a social media sensation. I think our family's pretty proud of her. But just this last Thursday, we were pleased to welcome another member to our family, Otto Gregory Cranville, our new grandson that just joined the world here last Thursday at 7:16. I was able to be there for his birth and actually get a picture with him about 3 minutes old, so that was a lot of fun. And you know, it's just great to have more people coming into the family and growing our family in that way, Mr. Speaker. Again, support in personal life has been great, and the support that they do give me, enabling me to do this job. As many would know, when you're doing this job during session, you're here 4 or 5 days a week, and outside of session, I'm usually here 2, 3, 4 days a week, so I am away from home quite a bit. Try and get home on weekends, but I'm so appreciative of the support and the love that I do get from my immediate family. Of course, we can't do this job, excuse me, we can't do this job without our staff support, Mr. Speaker. My staff back in Yorkton, Loretta and Rochelle, do an amazing job representing me and doing the casework day-to-day back home, so I want to give them a huge shout-out and thank you. And of course, the staff here in Regina, the Minister's office staff, both in the Minister of Health and the Minister of Rural and Remote Health's offices, work very much together, and we just couldn't do our jobs without them, so I'm very appreciative of their support, both personally and work support as well, Mr. Speaker. Of course, our colleagues, our former Premier Brad Wall, who has now gone on to a different part of his life. He's just such a great support, such a great leader. We do miss him, but you know, we're just so happy for him moving on, and again, moving on to the next part of his life. But of course, our new Premier, and I would count as a friend, our member from Rostron Shelbrick, is doing just an amazing job, and he's growing into that role in an amazing way. And I recognized that before in the work that he had done in the different files that he had held, representing us around this province and even nationally and internationally. And the way he's growing into this new role as Premier and leader of our party is just an amazing job he's doing. So we're just so thankful for him. I'd be remiss if I didn't mention my friend and colleague that I work with day to day, the Minister of Health, the member from Rosetown. Is a great support and friend as well, and I'm going to refrain from poking at him because he's right here and he might. But he's a great friend, and I really do appreciate his support and being able to work with him every day. Of course, my fellow MLAs, I'm very proud of all of them. They're great colleagues and do a great amount of work and really represent their constituencies very well. I want to give a specific mention to two of my neighboring MLAs, one from Conorapelli and the Minister of Government Relations, a member for Melville Saltcoats. Over the last year, there's been a lot of situations where I wasn't able to attend maybe some events and things at home, and they were always willing to step up and cover me off in my Yorkton constituency, so I'm just so thankful for them as well, Mr. Speaker. And of course, our three new MLAs on this side of the House, the member for Swift Current, the member for Kinnersley, and of course the member for Melfort that just joined us over the last little while, Mr. Speaker. So thankful to have them on this side of the House winning those elections. but more so the contribution that they have and will be making to the government and representing their constituencies in the coming years that they will serve here, Mr. Speaker. So congratulations to them. And of course, congratulations to you in your new role as Speaker, Mr. Speaker. I count you as a friend as well, and so far you've been very kind to me. You haven't thrown me out of the house, so I'm appreciative of that, and you're doing a pretty good job. So we'll try and stay on your better side. Of course, all the people of the constituency of Yorkton that have given me the honour of serving them here, I'm very appreciative of them, and of course of the support I will mention too that I've gotten from them over the last year and a half, Mr. Speaker, and also the people we work with day to day in the caucus office, and more specifically with the Minister of Health and I, the Deputy Minister, his office with the Assistant Deputy Ministers, all their support staff, of course our new Saskatchewan Health Authority, all the executive that is running that new health authority, the work that they're doing. Almost a seamless transition to the single health authority, Mr. Speaker. I want to mention them, and of course the great work that they've been doing, and so thankful of them, the CEO, Scott Livingston, and the work that he's doing over there. And you know, Mr. Speaker, I had a lot of faith in Scott when he was named to that position, and the work that I've seen him do at the Saskatchewan Cancer Agency over the years, how he's taken, how he's led that agency to a point of you know, delivering a very specific healthcare service, but delivering it effectively both urban and rural and remotely in this province, specifically cancer care, which can be quite broad in delivery. But the way they've done such a great job in building that system and delivering that service to people around this province, regardless of where they live, and taking some of that philosophy and some of that experience and now moving into the Saskatchewan Health Authority, I have a lot of confidence in the work that him and his team are going to be able to do. Mr. Speaker, as with any budget, there's some things we can point to specifically for our communities, for our constituencies, but also realizing that so many of the things that are in this budget do impact the province and namely our constituencies directly and sometimes indirectly. So I'm going to just touch on a lot of those. I know my fellow members are going, and ministers are going to be focusing more on some of their portfolios and some of these other things. So I'm going to briefly touch on some of those, and I'll focus more on the health portfolio as time allows, Mr. Speaker. So, of course, the theme of this budget is on track, has been mentioned, and that's because our balanced budget approach is on track. Of course, many realize we were over $600 million deficit last year, being able to achieve a plan of $365 million this year, and moving to a $6 million surplus next year. And then on the out years, $108 million and $212 million surplus is very achievable, and planning for those in the coming years, Mr. Speaker. Of course, how are we going to do that? Well, there's a number of different ways we're going to be able to do that, Mr. Speaker. First and foremost, something we've strived very hard to do over the last number of years is controlled spending. And as many, I think, realize throughout the province that, you know, controlling government spending is a necessity. And one of the things that I think some aren't really aware of is that we've been hit with a resource revenue reduction because of the soft oil and potash, uranium, and other resource sectors of about $1 to $1.3 billion per year over the last coming up to 4 years. So we've had to do a lot of initial work over those years to offset some of those losses. So that work has undergone a lot of work, a lot of attention, and gotten us to the point that we've, admittedly last year we had to make some difficult decisions to start bringing ourselves back to balance. But looking at some of the initiatives that we have done over the years that continue to happen, Minister of Central Services, my seatmate, some of the initiatives he's done with reducing the CVA fleet, or maybe eliminating executive air services to save money in that respect, Mr. Speaker. So a lot of those things we're doing internally to save money. Some of the reductions that have happened over the years in the Executive Council and the Premier's office and in staffing situations right here in this building have helped save some money. So I think we're leading by example. So we'll continue to do what we can in controlling spending in as many areas as possible without impacting people to the best of our ability as much as we possibly can. Of course, this budget we've talked about quite a bit about no tax increases, although with the PSD we have done a little bit of a shift when it comes to used cars, but for the most part no tax increases. And first and foremost, the most important thing is we are not going to implement a carbon tax, which I know many members across the floor seem to support. But Mr. Speaker, when you think about even some of the criticism we've gotten recently about the $60-some-odd million that the federal government had offered if we implemented a carbon tax over a 4-year period, you know, $10, $15 million a year. But to do that, we'd have to implement a $4 billion impact to the people of this province, something we're not willing to do, and we will not do that, Mr. Speaker. When it comes to fulfilling some of our commitments to some of the expectations of the people of the province, when it comes to the services that they require or expect, Mr. Speaker, I will talk about healthcare a little bit more in depth in a moment or two. But of course, my friend, the member from Saskatoon Northwest, the Minister of Education, our Deputy Premier, some of the money that he put back into the budget, $7.5 million in-year funding last year, $30 million this coming year for classroom supports, I think is a very good move and very appreciated by the sector. A lot of the funding increases that have gone to foster families, caregivers, community-based organizations, I think $10 million additional funding to CBOs this year, Mr. Speaker. Investments in the north, such as the group home in La Ronge and other investments, Mr. Speaker, and even some of the other investments when it comes to infrastructure or programs, say specifically through the Health Authority, that do directly impact the north. We know previous to the Health Authority development that the northern regions actually realized a higher increase in their spending in the northern health regions than some of most of our southern health regions, Mr. Speaker. So I believe we are paying attention to those needs and trying to respond as best as we can. When we look at infrastructure investments, there's been significant infrastructure investments. I know the member from Kenora-Pelly that was seconding the motion talked about some of those, the significant investment we've made in infrastructure over the years in multiple ministries, whether it's highways, hospitals and healthier schools, and across the board, Mr. Speaker, and those investments continue. Not a whole lot of new capital investments this year, but continued investments in infrastructure to finish some of these very important projects that we have been working on, namely the Children's Hospital, the Jim Pattison Children's Hospital, the Saskatchewan Hospital North Battleford, and others, Mr. Speaker. We see some significant investments in infrastructure as well when we look around the province, although some of these are specific to Regina or Saskatoon, whether it's the bypass or whether it's the bridge project up in Saskatoon. But so many people from here do go to those communities, and it does help them when they're moving around those communities, but also helps our economy, which benefits our whole province, Mr. Speaker. And of course, I would be remiss if I didn't mention a lot of the twinning and the passing lane projects that we've undertaken. And in this budget, $1 million put towards planning and design of the passing lanes between Melville and Kenora, which, as you would know, goes right through Yorkton. So a lot of traffic that does move between Yorkton and Melville, Yorkton and Kenora, realizing these passing lanes will just be a great asset to our community and, of course, increase highway safety there in the coming years. Plus, my understanding is the design will include some work around the intersection just north of Yorkton that turns truck traffic, a lot of heavy truck traffic, into the P&H plant. It turns them into the grain millers plant, one of the largest oat processors in North America, I believe it is. And of course, Grain Millers Road leads right down to the canola plant. So in the coming years, planning on getting that connection done so we can move that truck traffic through that intersection and down to some of those facilities. I think it's been spoken to at length, so I'll just touch on some of these, Mr. Speaker. Keeping our economy strong, of course, funding through the Saskatchewan Trade and Export Partnership, increasing our export capacities, some of the new tax incentives, namely the Saskatchewan Value-Added Agriculture and Saskatchewan Technology Startup programs to support investment, job creation, and productivity. And then, of course, incentive programs to encourage mineral exploration, grow and diversify our mineral sector, which we know a lot of our family members and neighbours do work in these sectors, whether it's potash, oil, gas, and the like, Mr. Speaker. So I did talk a little bit about our keeping our balanced budget on track and where we're going from here, Mr. Speaker. The tax changes that I did speak about. One thing I want to touch on briefly is our revenue sharing with our communities, and I understand our local community of Yorkton initially was impacted, probably one of the hardest percentage-wise. When I realized that we were being impacted by a high percentage, I immediately called the Premier and some of my colleagues and asked, is there something we can do, not only specifically for Yorkton, excuse me, but to minimize the impact on some of our municipal partners. So that's when we came up with the plan to cap these impacts by 30%, which effectively went from a $1.6 million impact to the City of Yorkton, returning half of that down to an $800,000 impact. So I think they were thankful for that return, although slightly disappointed as to what the way the program had rolled out. But realizing that we were going to move to a new revenue sharing program, but specifically something to replace the grants in lieu, which has been pointed out, is kind of an ad hoc and doesn't really make a lot of sense, and is quite an unbalanced and unfair program. So what we moved to this year, there's a little bit of backfilling capital that keeps places like the City of York and my own municipality from having any further impact from last year, but also moving to a new plan that actually impacts or actually pays for the grants in lieu of property taxes. So government entities, Crown corporations within my municipality will be getting those grants in lieu to offset those taxes that they don't collect. So that'll be a direct, understandable program to cover those grants in lieu. And then we look at some of the other programs that were sort of all over the map when it came to some of the grants in lieu, so to speak, that came from the Crown corporations. And of course, as you realize, we're moving to a surcharge system that will put those monies back directly into that community that are collected from that community. So initially, there shouldn't be a very large impact, a zero impact to my community, but as we are a growing community, as industry comes, as people come, and the usages of some of these resources, some of these sources increase, they will increase over time, an increase in that income, and I'm very confident that it will be a very good plan, a better plan than is right now, and a very fair plan going into the future, Mr. Speaker.
Well, it wouldn't have mattered. Here at 16.
So just in general, you know, we're supporting a strong and growing economy. We're investing again in healthcare, education, social services, protective services. I think I mentioned the $4.9 million, maybe I didn't, going to the rural crime strategy, which is very important, not only in some of these areas that have been in the news lately, but also in communities like my own, where we do have a lot of rural areas, a lot of farmers that they want to feel safe as well. So I'm thinking, and I'm believing that with the increase in police presence, with some of the other partners in the rural crime strategy, we're going to have a very effective system now and into the future. So, Mr. Speaker, I'm very proud of the plan that, of course, was originally put in place by our former Premier and carried on by this Premier with some additional changes. That is, I believe, paying dividends to our province. I just want to briefly go through, of course, some of the investments in healthcare, which is the portfolio that I co-minister with the member from Rosetown. We know that there's an additional 2.5% lift in healthcare, which I think is appreciated by many. We have the $3.5 billion for the Saskatchewan Health Authority, which does include $25 million for the general operating and pressures, $19 million of the federal funding to support the provincial connected care strategy to improve access to community-based and team-based community healthcare services and primary care services to our community settings. And we know through some of the work that was done through the Accountable Care Unit in Regina, and we're expanding that program, of course, here and into Saskatoon as well. And then with some of the community health services that will be integrated over time with a team-based approach, are going to be very proactive in, I think, getting our population healthier and offsetting some of those pressures in our emergency rooms, Mr. Speaker. Of course, we know we have the investment to phase in the increased physician capacity at the Jim Pattison Children's Hospital. Of course, money in the budget to implement the staffing and the startup of the Saskatchewan Hospital North Battleford. You know, the additional funding that is coming both federally and provincially to improve mental health services throughout the province. Not only just families, but children and many other people, Mr. Speaker. And I think a lot of the members have already spoken about the Universal Newborn Hearing Screening Program that has $523,000 in funding. Of course, capital funding, I spoke about some of the big projects, the Children's Hospital, the Saskatchewan Hospital North Battleford, but also some of the other smaller funds that are going to upkeep maintenance and improve some of the electrical services in some of our specifically major hospitals. And of course, those funds that are going to finish those projects that are already underway. One of the, a fairly big chunk in this budget, Mr. Speaker, is the $49.4 million to additional money for physician services. And that's because, not necessarily that we're less healthy, but it's because we have a growing province. We have 160,000 additional people here. We have a younger population. A lot of our seniors are living longer and of course, staying in the province, not moving off to BC to Kelowna or wherever to retire. That does impact our healthcare system. So we have additional pressures. So we are, of course, putting extra money in this budget to offset some of those physician pressures and continue with the plan we have been doing with training more doctors and hiring more doctors, nurses, healthcare professionals. Contrary to some of the words of the members opposite about cuts in healthcare, we have more doctors, more nurses, more care aides and all the like, all the way through the healthcare system that are working in this province year over year, Mr. Speaker. One thing I know the Leader of the Opposition is very close to his heart, and something we were very proud to put in play this year, Mr. Speaker, was the additional funds for the HIV strategy. Not only $50,000 to AIDS Saskatoon, $50,000 to the Westside Clinic, but also the $600,000 additional to provide 100% funding for HIV drugs, Mr. Speaker. And we know that it's very important that we get this under control, that it is a very communicable disease, but as long as we make sure that these people have access to their medications and they are easier to take medications now, Mr. Speaker, we can start getting ahead of this, this terrible disease. One thing I have to admit I sort of shook my head at this afternoon during question period. The Leader of the Opposition referring to us adopting some of their ideas, and I'll point to one, Mr. Speaker. The individualized funding for autism services. I don't remember ever hearing the NDP talking about that, but here's their idea of autism services, $500,000 annually, Mr. Speaker. $500,000. We upped that autism support to $8 million, and now with this additional $2.8 million in support to individual autism services, Mr. Speaker. That's I think, a far cry from their idea of $500,000, Mr. Speaker. The additional money going to the Canadian National Institute for the Blind, I know they're very appreciative of that. They're doing great work, so we're happy to support them. And of course, the extra money going to Fetal Alcohol Spectrum Disorder Network to help them with their work, Mr. Speaker. Of course, mental health is a very important to everybody in this House, important to everybody in this province, specifically in light of some of the tragedies we've seen in the north, some of the tragedies we've seen around the province with youth and unfortunately sometimes resorting to suicide, Mr. Speaker. And you know, it's something that touches everyone's heart. We're all, I think a lot of us in here are parents, aunts and uncles, and to hear of a young person taking their life is you know, almost nothing, there is nothing more tragic, Mr. Speaker. So we look at total health care funding for mental health, about $275 million plus. Of course, when we tie in the addictions funding, which is broken out of that, it's an additional, I think, $45 or so million. But then if we look at the other ministries that actually provide mental health supports, whether it's the Ag Health, Mental Health line, or many others, Mr. Speaker, about $85 million extra dollars. So I know a lot of that isn't included in other provinces, but when we look at that, our spending is pretty significant. And of course, the Minister of Health has talked about it at length, and so have the Premier and Deputy Premier and others, that we're going to continually strive to hit that 7% target, and we will continue to work towards that goal, Mr. Speaker. You know, we're going to, something that's close to my heart, remote presence technology, we're going to continue to support that through our health authority, implement not only telehealth, but of course the nurse robots, the health in your hands, the doc in a box, so to speak, is a very effective piece of technology that works amazingly well, and look at expanding that into every area we can to continue to support healthcare, but also rural and remote healthcare where it's actually the most effective. And of course, something close to my heart is EMS. I've been doing a lot of work on the EMS file. I really want to thank Ron Dufresne, who formerly was, I think he owned Moose Jaw Ambulance Services. He went to I think the ministry for a bit. He did a lot of work at Air Ambulance to get some challenges under control there, and it's just an amazingly operating and valuable service. But also he worked at STARS for 5 years, and now he's been doing a lot of work on the EMS file and really effective there. So I'm very thankful for the work that he has done, Mr. Speaker.
In conclusion,
Mr. Speaker, it seems like I'm getting the hook here right away. So, you know, there's one thing, much to the chagrin of my colleagues possibly, there's one thing I really want to touch on in healthcare, and it's very personal, Mr. Speaker. I touched on it a bit, but over the last year and a half, I was diagnosed, about a year and a half ago, I was diagnosed with colorectal cancer. And I want to thank the members on this side of the House, the Premier, former Premier, this Premier, and again, so many people that did offer so much support. But I really want to thank specifically the people in the healthcare system for my personal experience. That, and why that is I didn't want to get any special treatment in the system. I was really impressed with the primary healthcare system at home, getting in for diagnostic imaging. I was triaged and got in for diagnostic imaging. You know, the word some would think is too long, but I understand the system. You get triaged, you get in, and of course that was done in a timely manner. But the work that was done through the Cancer Agency, I just can't say enough about the great work that they did there. Mr. Speaker, I would quite often I'd be in at work early in the morning and I'd throw off my jacket and my tie when I knew I had about 15 minutes to get to the Alan Blair Cancer Centre, and so they had no idea who I was. So over time, asking questions and building a relationship with them, it took about 4 weeks for them to figure out that I was a Minister of Rural and Remote Health, which was very interesting to see how the care, how great the care was without them knowing anything, just how they treat all the patients. It really gave me a true appreciation for them. But also, you know, once they found out who I was and what I represented, some of the quite honest conversations I had, whether it was around continuous improvement or some of the other things, Mr. Speaker, but it really encouraged me as to how they were accepting of a lot of these practices. They realized a lot of the improvements, but I was also willing to listen to some of the challenges that they had. So that was a very eye-opening experience. And of course, being the Minister of Rural Health, getting my surgery back home in Yorkton, very appreciative of all the healthcare professionals there. And again, I'm going to wrap this up, but just so appreciative of all those medical professionals that did give such great service. So, Mr. Speaker, with that, thank you very much for your time. I thank my colleagues for enduring my long-winded speeches. I will be supporting the main motion, seconded by the member for Kenora Pelly. I will not be supporting the amendment.
Hear, hear. Good.